Hey, my name's Jason. I'm a registered polysomnographic technologist, as well as a registered sleep technologist, and I just want to talk about insomnia and the different types of insomnia that there are. So, first of all, there's transient insomnia. Transient insomnia is when you have a difficulty in initiating and maintaining sleep for usually under a week or so, and these typically are times where there's just a change in the environment, maybe a little bit of stress, and then it goes away. The next is acute insomnia, and this is typically called stress-related insomnia, and this usually lasts about a month or less. Oftentimes, there's some major stressor. I had this happen to me where there was just major stress in my head at night. I'd be tired all day. I would basically fall asleep trying to think of all the possible scenarios and how to solve each one of them should they come up. So this, took me a month to get over this, or actually it was about 3 weeks. It took me about 3 weeks to get over it, and I finally slept. So it's acute insomnia. And there's chronic insomnia. Chronic insomnia is, lasts a month or longer, often years, and typically there's something underlying with this that you should absolutely seek medical attention for. Most often it's undiagnosed sleep apnea or undiagnosed upper airway resistance syndrome, which is a lesser degree of that. It could be any type of sleep disorder, breathing or a sleep disorder. Best thing to do is check with a sleep specialist about this and get an evaluation in a sleep center. Oftentimes, people with chronic insomnia will describe their life as living in a fog. But one of the interesting things is there's these new home sleep tests that have come out, and oftentimes people will, take these little units home, sleep with them for a night or two. Then their doctor will say, "Oh yeah, it looks like you don't have anything." Well, these things don't really pick up all that much. They're not all that accurate, and so what you're going to see is a lot of people are given false negatives, or they're told, "No, everything's fine," but actually they do have something, and so really they go through life thinking, "No, I've been screened for apnea. There was nothing," and yet there really is something. So you have to be careful with that. What you do about it, I don't know. Probably pressure your doctor to go in for a full sleep study, and then hopefully hopefully it's caught at that point. The next, which is, it's really not an official term, but it is very much real for people who use it. But if you are diagnosed with sleep apnea and you're put on CPAP or APAP, BiPAP, I'm including all of those under CPAP, is CPAP Induced insomnia. Now these are people that fall into a category where a couple things could be happening. Some people, they have a lot of anxiety over basically their sleep being, how do I describe this? Their sleep being invaded. Sleep is a very personal thing, and then all of a sudden you've been sleeping for one way, being without a mask or anything, for 30, 40, 50 years, even 60 years, and then all of a sudden you're having your sleep space invaded by a mask, a machine, tubing, a new way of breathing, and a lot of that brings with it a lot of anxiety. I know I had to use CPAP briefly, and I had a lot of these feelings. It was just, it's not fun having your sleep invaded, because it's like your time to unwind, and you have this stuff on your face and on your head, and it can bring about anger, just frustration, that sort of thing. So one of the treatments for that would be cognitive behavioral therapy, which you'd want to talk to your doctor about if this is something you're experiencing. Basically what they would do is help you, walk you through the feelings that you're having. They try to give you a positive spin on it, and a better way of dealing with it and thinking about what's occurring, which basically it's saving your life. That's kind of what after choking enough in my sleep, I finally said, wearing a mask isn't all that bad. I actually feel better during the day. That sort of thing. It's just putting a positive spin on it, for the most part. But another thing, it could either be coupled with this or something else entirely, and that's that, yeah, you're on CPAP, yes, you were treated for sleep apnea, but is your treatment actually working? So the thing to do is look at, scrutinize your pressure. First of all, if you put on CPAP, give it some time to make sure that everything's working. If after a month you're noticing that you're not feeling any better, then start scrutinizing what's actually occurring. Are you waking up with a dry mouth if you're just wearing a mask over your nose? In that case, you may have a mouth leak. that's causing you to wake up, and it's diminishing the therapeutic effect of your CPAP. If you have dry mouth, that's a dead giveaway. You can always try a mouth guard, double-sided mouth guard to keep it locked. You can try a chin strap. A really good thing, if you can, is try a full face mask. That'll take that out of the equation, a mouth leak. Other things are, you may be on the wrong pressure. You can always ask your doctor if they really truly believe that the pressure is right for you. Maybe you need a little higher pressure, maybe you need a little lower pressure, maybe you need a different mode of pressure, so you maybe need to shift to BiPAP, maybe you need BiPAP Auto SV. Who knows? These are all things to ask your doctor about. But one of the problems with these nowadays is that a lot of people are going home with a home sleep test, which I mentioned before, really doesn't give you much data, and then they're sent home with an auto titrating CPAP for just permanent use. And so you never see, are there leg movements going on? Are RERAs occurring? Which, if you don't know what RERA is, you can go to my website, freecpapadvice.com, look up RERAs and find out what those are. But those could be occurring and basically undiagnosed. Even if you're using a CPAP machine that's auto titrating, those we've seen in our own lab tests that those are not titrated with auto CPAPs or APAPs. They just seem to miss them. They're not quite sensitive enough. So that's something to look into. Just because you basically have to scrutinize all your own data. A good way to do that is just be in constant communication with your doctor. You can also, there's download Sleepyhead. It's a software. It's free, and if you use CPAP or APAP in a specific type of machine, there's 3 machines that it supports, you can look at your own data, look at each breath by breath data of each night, check your leak data throughout the night. Really a cool program. But if all that fails, you need to be in contact with your doctor and really take care of yourself, because there's likely something wrong. And the last thing is, it could just not be, it could be some other medical reason. Like, everything in life isn't related to sleep, but like 95% of it is for sure. So if you have any questions, let me know. You can always contact me on my forum, freecpapadvice.com/forum, or look up other information at freecpapadvice.com. Thanks, bye.